Dear audience, when we mention leg aesthetics, mainly, I want you to know that this is the calf area of our region. In the calf region, particularly beneath the knee, the lower leg can be bent in a bracket shape. Alternatively, our leg might be quite slender, or it could be very thick. Basically, these are the existing problems, especially in the calf area below the knee. If the leg is very thick in this area, the main solution is to perform liposuction to slim the calf. During the examination of the patient, we need to assess the thickness of the subcutaneous fat in the calf region. And after this evaluation, we can only understand if we can be of help to the patient. Suppose the thickness of the subcutaneous fat tissue below the knee is very pronounced and excessive. In this case, we can assist you with the liposuction method. However, the liposuction technique we will apply here must not be the classic method. With less pressure, we must implement a liposuction technique that enables us to shape more, intervene more, and do it with more precision and slowly. We must apply a different liposuction method. By doing this, we can notably reduce the size of the lower leg, especially the calf region. Post-surgery, we will have to use compression stockings on our legs for around 3 weeks. We can achieve a bit more slimming of the leg by applying some compression to the calf area, allowing the skin to stick inward a bit more. Of course, when the leg is thin and curved like a parenthesis, we essentially have 2 options for a solution. The first option is fat injection. We can take fat tissue from any area of the patient's body, prepare it and inject it into the required area. This can be injected to thicken the leg. Alternatively, we can remove the parenthesis appearance from the leg. Fat injection is an excellent method because it uses material from the patient's own body. There is no risk of rejection. The sole drawback is, I want you to know that depending on the severity of the deformity, 2 or 3 sessions may be necessary. In any case, we will be able to obtain superb results in 1, 2, or 3 sessions. Our other option is the use of silicone implants in thin or curved legs. Using silicone implants, we can effectively resolve the patient's issue in 1 session and get outstanding results. Typically, this operation is done with a tiny incision along the back of the knee's folds where we insert a silicone prosthesis into the muscle fascia beneath it. Therefore, since we place the silicone prosthesis under the muscle fascia, there is no possibility for you to feel it afterwards by touch. Thus, we can address this problem in a single session with a 30 to 45 minute operation, simply numbing the waist without general anesthesia. The silicone implants used are lifetime silicone prostheses and are of high quality. Behind the knee. At the end of the operation, we seal the cut made along the skin fold behind the knee with aesthetic self-dissolving stitches. Therefore, you will not experience any issues in the long term after the surgery. Being someone who often performs these surgeries, I have some key points to ensure the patient does not suffer from tension-related pain post-surgery. There are key points. For example, you will be very surprised that when you stand up after this surgery, I even tell my patients to please come to the hospital wearing high-heeled slippers. I suggest they wear high-heeled slippers. You will notice that when you wear high-heeled slippers in the hospital or at home after discharge or while walking on the street in high-heeled shoes, it makes a difference. You will have very little pain with the silicone prosthesis during surgery. You will be able to return to your social life and work life comfortably within an average of 7 to 10 days after the surgery. After 3 to 4 weeks post-surgery, you will be able to do any sport you desire. However, there is a downside to this surgery. Your wardrobe will need to change. Typically, patients with bow-legged problems do not wear mini skirts or knee-length skirts. They do not wear them. They either wear slightly longer ones or loose-fitting wide leg pants. your wardrobe will change after this surgery. You will have more miniskirts in your wardrobe. You will wear more high-heeled shoes, and the most significant change will be a boost in your self-confidence.